Hi everyone, welcome to our YouTube channel Pharmaforge, and today we are going to discuss the topic that is drug use in treatment of cough. Cough is a protective reflex that clear the respiratory tract from accumulated mucus and any foreign particle. During respiration, if any foreign particle come in our body, it need to be expelled out from the body, and cough, because of cough it is expelled out from respiratory tract. And so cough is a protective reflux in our body, means it is one of the response to our one of the response by our body to that foreign particles. And cough is of mainly two type, that is, one is a productive cough and another is a non-productive cough. Non-productive cough is also called as a dry cough. Non-productive in non-productive cough, it is characterized by the sensation of the irritation or dryness in the uh, respiratory tract. And in case of productive cough, there is a excess production of the mucus in respiratory tract, and it lead to the congestion. So in case of productive cough, when any foreign particle come in our respiratory tract, there is a formation of mucus in the respiratory tract. And finally the firstly the deep inspiration occur, and after deep inspiration, bronchoconstriction occur, and by that bronchoconstriction process, that particle is expelled out from respiratory tract. This is normal process to expel that foreign particle with the help of producing mucus. But in case of productive cough, that mucus produced in very excess amount, and there is a formation of plug of mucus. Plug of mucus is produced, and that plug of mucus is very viscous in nature. It is very viscous in nature, and that's why it is difficult to expel out that mucus plug, and it lead to the congestion, that is productive cough. Means a person cannot breathe properly because of that cough. uh, इन सिंपल लैंग्वेज, प्रोडक्टिव कफ में ऐसा होता है कि बहुत एक्सेस में म्यूकस प्रोड्यूस होता है. जो भी कोई फॉरेन पार्टिकल रेस्पिरेटरी ट्रैक से एंटर हुआ है, उसको बाहर निकालने के लिए इतना म्यूकस प्रोड्यूस होता है कि उसका एक बड़ा सा प्लग बन जाता है, कि जो प्लग इतना विस्कस होता है कि वो एक्सपेल करने में बहुत डिफ़िकल्टी होती है. दैट इज़ सो पर्सन अच्छे तरह से सांस नहीं ले पाता है, एंड उसको सांस लेने में दिक्कत होती है. दैट इज़ अ प्रोडक्टिव कफ. देन एक्चुअली जो ये प्रोडक्टिव कफ होता है, उसमें एक्सपेक्टोरेंट यूज़ किया जाता है और म्यूकोलाइटिक एजेंट यूज़ किया जाता है. एक्सपेक्टोरेंट यूज़ किया जाता है क्योंकि वो क्या करता है कि उस कफ को इजीली एक्सपेल्ड आउट करता है, मीन्स उसको इजीली निकाल देता है. कफ को इजीली निकालने में और उस एक्सेस म्यूकस को निकालने में एक्सपेक्टोरेंट हेल्प करता है. एंड म्यूकोलाइटिक मीन्स those agent that causes lysis of that mucus, means it causes the breakdown of that mucus. उसको तोड़ देता है, छोटे छोटे टुकड़ों में उसको तोड़ देता है. म्यूकोलाइटिक मीन्स वो जो म्यूकस का प्लग बना है उसको छोटे छोटे टुकड़ों में बांट देना, वो काम म्यूकोलाइटिक एजेंट करता है. मीन्स when we talk about the productive cough, in treatment of productive cough, expectorant means those drug that facilitate the process of expelling out to that mucus, means they are responsible for the forcefully expiring that mucus. And second is a mucolytic are agent which help to lysis of that mucus plug, and help to expel it out. This is here the classification of drug used in treatment of cough is given in this slide. So first is a expectorant, then second is a mucolytic, third is a pharyngeal demulcent, and last is a antitussive agent. So one by one we will discuss. That is expectorant. In that, sodium and potassium citrate is there, ammonium chloride is there, guanfacine is there. In case of mucolytic, bromohexane, ambroxol, this drug come in the class of mucolytic. Then third is a pharyngeal demulcent. In pharyngeal demulcent, lozenges, linctus, and licorice. Licorice means muleti, that is demulcent class drug. And last is a antitussive, in that flocodane, codeine, and dextromorphan. This is about the classification of drug used in treatment of cough, that is expectorant also called as mucokinetic drug, means those drug that facilitate the process to expel out that mucus. Then second one is a mucolytic, those drug that help in the breakdown of that mucus plug in small droplets, so it can easily expelled out from nose. And third is a pharyngeal demulcent. Pharyngeal demulcent, they are used to give soothing effect to the in case of dry cough. Pharyngeal demulcent it gives soothing effect. And last is a antitussive agent and pharyngeal demulcent, they are preferred in treatment of dry cough, because here there is no excess production of mucus. It is due to the any unwanted any unwanted sensation that is given by the afferent nerve to the cuff center, that is given by that afferent nerve to the cuff center. So that that impulse should be terminated, means it should be controlled. The agents like antitussive is used, and pharyngeal demulcent are used to treat the dryness in case of dry cough. So in antitussive agent, flocodane, codeine, and dextromorphan, these drugs are most commonly used. Then one by one we will discuss. That first is a mucolytic agent. Mucolytic are agent that causes the lysis of the uh, disulfide bond that is present in the glycoprotein of the mucus, and convert that mucus plug into small droplets. Means mucolytic agent, they are responsible to liquefy that sputum and make it easy to expel out. So in this mucolytic category, bromohexane is there, then acetylcysteine is there, carbocysteine is there. Ambroxol is also in the class of mucolytic agent. Bromohexane, it is a derivative of adhathoda vasaca. Adhathoda vasaca means it is belonging to the family Acanthaceae. And this bromohexane, it produces the lysosomal enzyme. Lysosomal enzyme is produced by the bromohexane, and it digests the mucopolysaccharide, and the mucus can be easily expelled out. It digests the mucopolysaccharide, means it causes breakdown of that mucopolysaccharide and help to liquefy it and expelled out. Then second is the acetylcysteine and carbocysteine. These are metabolite of the bromohexane. And acetylcysteine and carbocysteine both given in form of aerosols. Uh, and Next is a expectorant. Expectorant means mucokinetic drug, means they help to expel out forcefully, to that mucus. First is the sodium and potassium citrate. They show this expectorant action due to their salt action. Then second is a guanfacine, then balsam of Tolu. They show uh, they promote the potentiation of the mucociliary action, means Ciliated squamous epithelium tissue, it is present in the respiratory tract to expel out the mucus. So this drug like guanfacine, balsam of Tolu, they potentiate this ciliated squamous epithelial tissue. The mucus can be expelled out easily from the respiratory tract. Then demulcent, as we discussed, demulcent are drugs that are used mainly to treat the dryness. In case of dry cough, this drug increases the production of the saliva and gives soothing effect in dry cough, and decrease the afferent impulse from irritated surface. Means जो भी कोई इम्पल्स है कि जो इरिटेटेड सरफेस से उस कफ सेंटर तक जा रहा है, उसको रोकना. और किससे रोकना? बाय द प्रोडक्शन ऑफ द सलाइवा. एक्सेस अमाउंट में सलाइवा प्रोड्यूस करके वो जो ड्राइनेस है वो कम करके सूदिंग इफ़ेक्ट फिर से लाके वो जो इरिटेशन वाला इम्पल्स है वो कफ सेंटर तक जाने से रोकने का काम वो डेमल्सन ड्रग करते हैं. And example of demulcent is different type of syrup, lozenges, then licorice, that is glycyrrhiza glabra, in simple language mulethi. Then non-productive cough, uh, for treatment of non-productive cough, antitussive agents are used. Then second is demulcents are used. So in case of non-productive cough, there is a dryness in region of pharynx and trachea, and that dryness causes irritation, and that impulse of the irritation is sent to the CNS cough center. And in normal case, when that a sensory message is sent by the afferent nerve to the cough center, it lead to the bronchoconstriction, to forcefully expel out that foreign particle, or which is responsible for the dryness. But sometime there is a unwanted dryness in regions of pharynx and trachea. Means there is no any foreign particle, but still there is a dryness in the region of pharynx and trachea, and which lead to the formation of the impulse that is conducted to the CNS. And antitussive are agents that inhibit the impulse to CNS. So in means they suppress the cough center. So first in that is a codeine. Codeine is a opioid category drug. It is mu receptor agonist drug, and the side effect that is associated with codeine is a constipation, respiratory depression, and abuse liability. Then second is a flocodine. Flocodine is a longer acting drug, comparatively less side effect than codeine. Third is a dextromorphan. Dextromorphan is a D isomer of the codeine. And last is a noscapine. Noscapine is a non-narcotic drug, means its abuse liability is no. There is a no abuse liability in case of noscapine. It is non-narcotic antitussive agent. Other than this, antihistaminic drugs are also used in treatment of cough, like diphenhydramine, dimenhydrinate, promethazine. Because as we know, these drugs are H1 antihistaminic drug, and H1 antihistaminic drug, they are with a anticholinergic effect or a sedative effect due to blocking H1 receptor in the brain. They causes sedation, and anticholinergic effect is their side effect. And due to anticholinergic effect of this H1 antihistaminic drug, respiratory secretion is reduced, respiratory mucus production is reduced, and that's why they are used in treatment of cough. uh, in this topic, uh, firstly, you have to understood what is dry cough and what is productive cough. Productive cough, that is characterized by excess production of the mucus, and dry cough, that is as its name indicates, it is characterized by the dryness in pharynx and trachea, irritation, sensation of irritation. And what is productive cough? what happens actually in productive cough. In productive cough, the formation excess production of mucus occur and formation of the plug of mucus, and because of uh, its viscosity, it is difficult to expel out that mucus. And In treatment of productive cough, mainly expectorant drug and mucolytic drug are used. So in expectorant, sodium and potassium citrate is there, then ammonium chloride is there, guanfacine is there, and in case of mucolytic, there is a bromohexine and ambroxol. Mucolytic means those drug that break the disulfide bond that is present in the glycoprotein of mucus. Uh, and as we discussed, that bromohexine is obtained from the Vasica adhathoda, and acetylcysteine and carbocysteine are its metabolite. Then in case of expectorant, sodium and potassium citrate, they show their expectorant action or mucokinetic action due to their salt action. And guanfacine, balsam of tolu, these drug are from the natural origin. And this drug, they promote the mucociliary action, means they promote the activity of the ciliated squamous epithelial tissue in the respiratory tract. And in case of the non-productive cough means a dry cough, when there is a no production of the mucus, but there is a dryness in trachea and pharynx. So in this, to treat this dryness, demulcents are used. Demulcent, they increase the salivary secretion, and they give the soothing effect to the uh, trachea or to the pharynx region, and decrease the afferent impulse from the irritated surface. And last, these are antitussive agent. Antitussive agent, they are mainly involved in suppressing the cough center, in that codeine, flocodane, dextromorphan, noscapine is a non-narcotic drug, means its abuse liability is zero. But codeine is opioid category drug, so uh, it is means patient can use it for the reinforcement means enjoyment of any drug, enjoying any drug, that is reinforcement. Then flocodane is a comparatively longer acting drug, less side effect than the codeine. And dextromorphan is also used in the treatment of cough, and it is a d-isomer of codeine. And last is a antihistaminic class drug are also used to treat the cough, diphenhydramine, dimenhydrinate, promethazine. These drugs are with the antihistaminic property as well as anticholinergic effect, means they reduce the production of the mucus, and they are with a sedative property. Sedation is one of the side effect of the H1 antihistaminic drug. This is about the drug using cough.